Hi, I'm Dr. Brian Thornburg, and I wanted to review the 2 pediatric measles deaths that have happened here in 2025. I want to compare and contrast the 2 cases. It's important to know the nuances of where these children came from, what happened when they sought medical care, provide any available information that we might have that is publicly available, so you as a mom, dad, making decisions for your family can understand the likelihood that this might actually happen in your house or in your community. This girl did have measles. Her chart was reviewed by Dr. Corey, and that was made public. The parents released the medical records so they could be reviewed by his distinguished physician. His findings are that the child did have measles, went to the hospital with a pneumonia as she was recovering from the measles. I am unclear if this child did receive a measles vaccine when she arrived at the hospital. So this child was begun on 2 antibiotics. The physician on record chose antibiotics that would support a diagnosis of a measles bacteria causing the pneumonia. Unfortunately, this was not the case. The child had a community-acquired pneumonia, which has a different bacteria as the predominant causative agent. The delay in the proper antibiotic resulted in this girl's passing. It is being called a measles death, but again, that may not be totally accurate if you look at all of the details. The second case is also a child from Texas. She's from Seminole, Texas. She is part of the Mennonite community. We do not have her medical records, so we don't have a detailed history of what happened prior to her arrival at the hospital, how long she may have had measles, what her hospital course was like, or what the complicating or confounding issues are surrounding her passing. We do know from extensive scientific sociological studies that the Mennonites do not pursue mainstream medical care. They prefer old-world traditions and will only seek advanced medical care in the most extreme of circumstances. That is likely what happened here. Again, I'm making an assumption. I want to make that clear. And as we compare her situation to you, if you come from a community that delays medical care, that is very rural or has poor access to medical care, if you come from a socioeconomic status where you may not have a lot of money to get to medical care or to buy good food or supplements or the antibiotics or other nutraceuticals that may help improve the child, like vitamin A, then you could probably align yourself a little bit more with this Mennonite community and the circumstances around this girl's death. But if you're coming from a household that has access to medical care, great nutrition, access to supplements like vitamin A, you can get to a hospital rather quickly. You have the knowledge to identify that your child is going downhill rather than waiting too long. Of course, there always has to be a disclaimer that anything is possible. This is life, and life often happens in very confusing and unexpected and surprising ways. So always keep that in mind. It's not straightforward. This little discussion, compare and contrast, hopefully you take that to your house and share it with your friends. Make the right decision for your family. Thank you.